Good morning, everyone. Bon vendredi tout le monde. I'm happy to be joined today by Ministers LeBlanc, Hajdu, and Anand, as well as by Dr. Tam and Dr. Njoo. First, let me begin by saying that it is with deep sadness this morning that we all learned of the passing of His Royal Highness the Duke of Edinburgh. Prince Philip was a man of service, motivated by a sense of duty to others. I know that through the Duke of Edinburgh's award, he helped empower millions of young people from all backgrounds, including here in Canada, to realize their greatest potential. And that's just one example of his many contributions. Prince Philip will be remembered as a champion for young people, a decorated naval officer, a dedicated philanthropist, and a constant in the life of Queen Elizabeth II. Le Prince Philippe était un époux.
Prince Philip was a husband, father, grandfather, and great-grandfather who was well-loved. My thoughts, and the thoughts of all Canadians, are with Queen Elizabeth II and all the members of the royal family. The rise in COVID-19 cases continues to be of concern. In several locations across the country, stricter measures are necessary to halt the spread of the virus. On Wednesday, during our 29th meeting of First Ministers of the provinces and territories, I repeated to the premiers that they can count on the continued support of the federal government. We are there for all Canadians. And if you need help, there are several programs to assist you. For example, if you have to miss work because one of your young children is ill or their school is closed, you may be eligible for the Canada Recovery Caregiving Benefit. If you can't work because you're sick or because you have to isolate because of COVID-19, you may also be eligible for the Canada Economic Recovery Benefit. These programs can help you with financial assistance whether you are a salaried worker or self-employed. So to all mothers and fathers who are working hard and to everybody else who needs support, don't hesitate. Go to the canada.ca/coronavirus site to get all the information you need on our various programs. We have to do everything possible to fight this third wave. Every effort counts, and every effort can save lives.
We're seeing more and more young people being admitted to hospital with COVID-19. So too young people. There are more contagious and more serious variants out there. Even if you're younger, you can get sick very, very quickly. Or you can give the virus to someone you love who can get very sick. I know you've already done so much and sacrificed so much, but we just need you to hang in there a little bit longer. And to people of every age, we still need your help. Together, we're going to get through this. Our path out of this pandemic is vaccines. So that's my #1 focus. Vaccine delivery and rollout is something I talked about with the premiers on Wednesday. So far, we've delivered more than 10.5 million doses to the provinces and territories. And I know that they're working to get these shots into the arms of Canadians as fast as possible. This is a true team effort, especially now that we're in the ramp-up phase of the vaccine rollout. Every day, more grandparents and parents are sharing their vaccine selfies on family group chats. Every day, more Canadians are safer. Vaccines are saving lives. And that's why we're doing everything we can to get more and more doses to the front lines. Until the end of May, we're scheduled to receive 1 million doses a week of the Pfizer vaccine. In June, we'll have almost 2 million doses a week delivered from Pfizer alone. For Moderna, we'll be receiving 2 million doses in April and almost 3 million in May. And we're anticipating to receive over 7 million in June. What this all means is that by the end of June, we can expect to have received at least 44 million doses of COVID-19 vaccines from Pfizer, Moderna, and AstraZeneca. Our government is in close contact with all companies that have approved COVID-19 vaccines in Canada to get the latest information on shipment schedules and amounts. Everyone is working around the clock to make sure Canadians are safe. This is true on vaccines and is true on a whole range of other things people need to stay healthy. On that front, I can confirm that we are extending the support of the Canadian Red Cross until the end of September for up to 27 long-term care and retirement homes in Ontario, as necessary. The Red Cross will continue to help each home with their individual needs while supporting better infection prevention and control measures. Every senior deserves to be safe and to live in dignity, and we'll always be there for the residents of long-term care homes and their hardworking staff. To all of the Canadian Red Cross employees and volunteers, and to everyone at the Government Operations Centre who helps coordinate these deployments, thank you. You are doing incredible work. On espère tous que la pandémie sera bientôt.
We all hope that the pandemic will be behind us soon. This morning, we learned that 303,000 jobs have been added to the Canadian economy during the month of March. This includes both full-time and part-time jobs. Unemployment has fallen to its lowest level since last February. This is encouraging news, but a lot of work remains to be done. We know that several people still are jobless or are working reduced hours, all the more so with new restrictions that are being implemented across the country.
To be there for families, workers, and small businesses. For those who need support, we've created the Canada Recovery Benefit, and we've strengthened employment insurance. For hard-hit businesses, we have measures in place that you can count on, like the wage subsidy and the Canada Emergency Business Account. Of course, there's also the Canada Emergency Rent Subsidy that can help your business or organization directly, including with additional supports if you're affected by lockdowns. As I've said from the start, we'll be here with the support you need. On that note, on April 19th, we will present our 2021 budget. We'll continue to focus on our plan to keep Canadians safe and healthy. We'll also share more about our plan to create good middle-class jobs so we can rebuild an economy that works for everyone. The pandemic has highlighted and worsened far too many gaps in our society. That's something we'll keep working on to address. And as we do, we'll continue to stand up for what matters to Canadians, whether that's finding a good, well-paying job, staying healthy, or having our kids breathe clean air. These are your priorities, so they're our priorities too, and they're priorities on which we will continue to deliver. As we've seen over the past year, it's vital that we all work together to get through this crisis. So that's why I'll be inviting all party leaders to meet individually with me to discuss the upcoming budget early next week. Avant de terminer, je veux encore
Before closing, I would like to thank everybody again, all of those people who are making efforts to fight this pandemic. Whether we're talking about the healthcare workers who are tired and who are so worried about their patients, essential workers who are still on the job despite the risks of catching the virus, or all of the people at home who are being careful and who are respecting the public health instructions. Thank you, and let's not give up. There are more and more people who are vaccinated now. Together, we can get through this. Thank you. And now I'd like to turn the floor over to Dr. Tam.
Bonjour à toutes et à tous.
Hello, everybody.
We'll provide an update on current numbers and trends, as well as developments on the vaccine front. The race between vaccines and variants is at a critical point. The modeling prediction from 2 weeks ago that forecasts a resurgence is playing out in the data we are seeing now, with case counts plotting along the strong resurgence trajectory. It is clear that we need stronger control to combat variants of concern that are driving rapid epidemic growth in many areas of the country. To date, over 1,036,000 cases of COVID-19, including 23,200 deaths, have been reported in Canada. Over the past week, there have been an average of over 6,800 new cases and 30 deaths reported daily, and the number of people experiencing severe and critical illness continues to rise. Last week, an average of over 2,500 people with COVID-19 were being treated in our hospitals each day, representing a 7% increase over the previous week. 860 of these people were being treated in intensive care units, which is 23% higher than the last week. The increasing predominance of variants of concern is the major contributing factor to these worrying trends, resulting in accelerated spread and more severe illness, including among younger and previously healthy adults. Over the past week, the number of new variant cases has more than doubled. To date, almost 25,000 variants of concern cases have been reported across Canada, with B.1.1.7 variant continuing to account for over 90%. All of these trends tell us that, even as vaccines are bringing us closer to end this crisis, we cannot afford to give this virus an inch. In areas with epidemic growth, the only way to get out of this crisis is the hard way, by staying home as much as we can and consistently maintaining our distance and wearing a mask when we must go out. Several jurisdictions have tightened restrictions to control rapid spread, but let's remember that essential workers will still be there, providing the vital supplies, care, and support we need. With gratitude, let's commit to doing everything we can to protect them by staying home whenever we can. On the vaccine side of the race, it's been another busy week. Supplies continue to increase, with over 10 million doses of COVID-19 vaccines distributed across the country to date. Provinces and territories have administered more than 7 million doses and are further expanding programs as the supply ramps up. Our experts and regulatory authorities have also been busy, ensuring that vaccinations are optimized for use in the Canadian context and engaging with international partners on the in-depth review of vaccine safety data. This week, Health Canada attended the European Medicine Agency's Safety Committee meeting regarding the recent safety signal linked to the AstraZeneca vaccine. The European Medicines Agency, or EMA, has reviewed all currently available evidence and considered the risk of hospitalization and death due to COVID-19 against the very rare occurrence of combined blood clots and low blood platelets, known as vaccine-induced prothrombotic immune thrombocytopenia, or VIPIT. There may be another name for this clinical entity coming out soon as well. Their assessment concluded that while there is a possible link between the AstraZeneca vaccine and this very rare blood clotting disorder, the overall benefits of the vaccine in preventing COVID-19 and its severe outcomes outweigh the risk of side effects. Last week, Canadian jurisdictions took the precautionary measure to pause the use of AstraZeneca vaccine in people under age 55, and to date, no cases of VIPIT have been reported in Canada. Health Canada will consider the latest evidence presented by the EMA, together with information being provided by AstraZeneca, to decide whether any changes are needed to the Canadian product label. The National Advisory Committee on Immunization will also review its recommendation in light of any new data in support of the provincial and territorial program decisions. Canada's health leaders are committed to working together, adapting approaches as the science and situation evolves, and keeping Canadians safe, healthy, and informed. We are getting closer every day, and we're more united and stronger for it. Thank you.
Bonjour à toutes et à tous.
Hello, everybody. Today we'll be presenting an update of the current trends and data and recent developments regarding vaccination. The race to vaccines and the variants is at a fateful point. The modeling of 2 weeks ago that had forecasted a resurgence has been demonstrated in the data we're seeing now. With case counts plodding along the strong resurgence trajectory, it is clear that we need stronger control to combat variants of concern, the variants that are driving rapid epidemic growth in many areas of the country. To date, Over 1,036,000 cases of COVID-19, including 23,200 deaths, have been reported in Canada. In the last week, over 6,800 new cases and 30 deaths have been reported daily on average, and the number of people experiencing severe and critical illness continues to rise. Last week, an average of over 2,500 people with COVID-19 were being treated in our hospitals every day. This represents a 7% increase over the previous week. Of this number, 860 people were being treated in intensive care units, which is an increase of 23% over last week. The increasing predominance of variants of concern is the major contributing factor to these worrying trends, which are causing accelerated spread and more severe illness, including among younger and previously healthy adults. Over the last week, the number of new variant cases has more than doubled. To date, nearly 25,000 variant of concern cases have been reported in Canada, with the B117 variant continuing to account for over 90% of cases. All of these trends tell us that even as vaccines are bringing us closer to the end of this crisis, we cannot afford to let anything slip. In areas with epidemic growth, the only way to get out of this crisis is the hard way. We'll have to stay home as much as we can and consistently maintain our distance and wear a mask when we must go out. Several jurisdictions have tightened restrictions to control the rapid spread. But let's remember, essential workers will still be there, providing vital supplies, care, and supports which we need. Let's commit to showing our gratitude by doing everything that we can to protect them by staying home whenever we can. On the vaccine side of the race, it's been another busy week. Supplies are continuing to increase, with over 10 million doses of COVID-19 vaccines being distributed across the country to date. Provinces and territories have administered more than 7 million doses and are further expanding programs as the supply ramps up. Our expert and regulatory authorities have also been busy. They have been ensuring that vaccinations are optimized for use in the Canadian context and engaging with international partners on the in-depth review of vaccine safety data. This week, Health Canada attended the European Medicines Agency's Safety Committee meeting. The European Medicines Agency is also called the EMA. The meeting was regarding the recent safety signal linked to the AstraZeneca vaccine. The EMA has reviewed all currently available evidence and considered the risk of hospitalization and death due to COVID-19 and compared this against the very rare occurrence of combined blood clots and low blood platelets, known as vaccine-induced prothrombotic immune thrombocytopenia, or VIPIT. Their assessment concluded that while there is a possible link between the AstraZeneca vaccine and this very rare blood clotting disorder, the overall benefits of the vaccine in preventing COVID-19 and its severe outcomes outweigh the risks of side effects. Last week, Canadian jurisdictions took the precautionary measure to pause the use of the AstraZeneca vaccine in people under 55. To date, no cases of VIPIT have been reported in Canada. Health Canada will consider the latest evidence presented by the EMA, together with information being provided by AstraZeneca, to determine whether any changes are needed to the Canadian product label. The National Advisory Committee on Immunization will also review its recommendation in light of any new data in support of provincial and territorial program decisions. Canada's health leaders are committed to working together, to adapting approaches as the science and situation evolves, and to keeping Canadians safe, healthy, and informed. We're getting closer to the goal every day, and we're more united and stronger for it. Thank you.
Questions from media. We'll start on the phone. Over to you, operator.
Thank you. Please press star 1 at this time. If you have a question, veuillez appuyer sur étoile 1 maintenant pour poser une question.
Press star 1 now if you have a question.
Our first question is from Anna Thibodeau from CBC National News. Please go ahead. À vous la parole.
Good morning. Thank you for taking our questions. Prime Minister, clearly some provinces are struggling to respond to rising infections, hospitalizations, even deaths, and we know you've offered to help the provinces if they ask for it. But I think as Canadians sit at home and see these record-rising numbers in places like BC, Quebec, and Ontario, they might be saying, is it not time that you tell the provinces you're stepping in?
Thank you for your question. I can understand the frustration, the anxiety, the concern that Canadians right across the country are feeling at seeing these numbers rise. I share it. I think we're all recognizing that we don't want to be in this third wave, but we're here. And as we've been doing from the very beginning, we've been working very closely with the provinces and territories to ensure that they have the supports necessary to make the right decisions for their jurisdictions. The caseload and the trajectory isn't the same right across the country. And what we've done as a federal government is stepped up so anywhere across the country, if there is a shutdown, if public health orders require people to stay home and they can't go to work, if small businesses are affected, our federal supports are there. Whether it is direct income support for workers who've been laid off, support for small businesses through the wage subsidy or through the CEBA business account or through the rent subsidy with a top-up for lockdowns, whether it was direct support of well over $19 billion we sent to the provinces and territories to help them manage their healthcare systems, dealing with rapid testing, dealing with vaccinations. We will continue to be there to work hand in hand and respect the provinces as they make the right decisions for their jurisdictions.
Follow up, Hannah?
Oh, yes, please. Thank you. Okay, so I take that as a no, that you don't feel you have to step in. And I want to move on to federal supports. So given how hard this third wave is hitting some communities, is there anything more you can do to encourage workers to stay at home when sick? Could you increase the amount or make a tax rebate for companies?
We have brought in the Canada Sickness Benefit to make sure that if people start seeing symptoms or they're required to self-isolate, they can collect support from the government while staying at home, so they can keep putting food on the table, so they can keep paying their rent, even if they're staying home to protect their loved ones and their community. There are many measures that this government has put in. We're always open to more, but I will highlight that we've already, when we designed most of these measures, built in natural or responsive adjustments to make sure that as future waves could hit, as we see right now, those systems would be in place and would adjust to be there to help the most vulnerable. We've already extended them to the summer, and we will continue to watch very closely to see if there's more we need to do or if we need to extend them even longer. We made a promise to Canadians that we'd have their backs. That's exactly what we're going to do for as long as it takes, with as much as it takes.
Thank you. Next question, operator.
Thank you. Our next question is from Marika Walsh from the Globe and Mail. Please go ahead. À vous la parole.
Good morning. Thank you so much for taking our questions. Prime Minister, you'll be speaking at your convention, your party's convention tomorrow, but tonight we're hearing from Mark Carney. Are you hoping he'll run as a Liberal candidate in the next election?
The Liberal Party has a long history of welcoming in expert speakers at our conventions on from a range of different backgrounds. we're very pleased to have someone of the stature of Mark Carney, who's been working very, very hard on, among other things, the intersection between the global economy and the fight against climate change. I know Liberals are very excited to hear what he has to say, and it's just another example of how we work together to listen to experts and the best and the brightest from around the world as we look at how to continue to focus on getting Canadians through this pandemic and on building back better.
Follow up, Marika?
And last night, thank you. Yeah, last night, Deputy Prime Minister Chrystia Freeland again made it clear how much of a priority some sort of national childcare program is for her. The issue has gotten a lot more attention under your government since she took on her new position as finance minister last year. I'm wondering if you can tell us your perspective on what you believe a national childcare program should look like in Canada.
I know people are very much looking forward to the budget on April 19th, in which we will share our perspective on how to grow the economy, how to create jobs, how to support Canadians, how to make sure that the middle class and people working hard to join it comes through this pandemic and our economy comes roaring back. The Liberal Party has been talking about childcare for a long time, and indeed, over the past 5 years, we've transferred billions of dollars to the provinces to improve childcare across the country. But we know, and this pandemic has certainly highlighted, that there is more to do. What we're seeing is that people have finally understood what the Liberal Party has long known, that childcare is not simply a social argument or a social program. It's fundamentally an economic program, getting more women into the workforce, allowing families to not have to make impossible choices between having another child or staying in the workforce. These are things that are good for the economy, and the business community right across the country has spoken up clearly and strongly in support of something that families and indeed women across this country have known for a long time. Childcare is something we need to do as a country.
Merci. Prochaine question au projet.
Thank you. Notre prochaine question nous vient de Geneviève Normand de Radio-Canada.
Next question from Geneviève Normand from Radio-Canada. Go ahead. Yes, my question is for both of you, Mrs. LeBlanc and Trudeau. Do you have any memory of Prince Philip? And could you say more about any links that you, Canada, have with the Queen's consort in recent years or decades? Of course, it is with great sorrow that we learnt of the death of Prince Philip. He's somebody that I've known my whole life. The first times I met him, I was a little child here in Ottawa. My best memories were conversations that I had several years ago, including during the Commonwealth meeting in Malta in my first months as Prime Minister. He was a fascinating man who has always been devoted to service and to the Queen. We are very, very sorry to hear of his death.
Had the privilege of knowing Prince Philip almost my entire life. The first times I met him, I was just a kid here in Ottawa many years ago. But obviously, over the past few years, I've had the opportunity to have a few more conversations with him. And it is a tremendous personal as well as public sorrow that we all share at his passing. In Malta a few years ago, actually a few months after becoming Prime Minister for the first time, I was able to have a number of wonderful conversations with him, and he is going to be sorely missed, not just by his family, but obviously by all of us. Dominic?
Merci, Monsieur le Premier Ministre.
Thank you, Prime Minister. I also share the sorrow of all Canadians when we learned this morning of His Royal Highness. The Prime Minister has refer to the incredible service that he provided over so many years and decades. His devotion to the Queen as well, I believe, has touched millions of people across the globe. I remember spending an informal evening. It was literally a barbecue on Canada Day. I'm trying to remember whether it was in 1997 or 98. Her Majesty and the Prince were in Ottawa. My father was Governor General, and there was a free evening, and Her Majesty suggested an informal barbecue, just two tables of 8 people, and it was my good fortune to be seated with Prince Philip. As the Prime Minister was, I was touched by his knowledge of Canada and the way that he talked about the service of young people and how he had devoted so much time to this cause.
I share the Prime Minister's comments, obviously, with respect to the sad news we learned this morning, the sad news that affected all Canadians with the passing of His Royal Highness Prince Philip, the Duke of Edinburgh. I, like the Prime Minister, have a particular memory of having spoken with him 25 years ago, probably, at an informal barbecue that Her Majesty had suggested be organized at Rideau Hall when they were in Ottawa for Canada Day. They had a free evening, and Her Majesty suggested that perhaps a summer barbecue. There were only 2 tables of 8 people at the dinner, and I had the chance to sit at Prince Philip's table and remember fondly his knowledge of Canada, his interest in Canadians and in Canada, but the passion with which he spoke about his service to young people. That is a memory I will always cherish.
Sylvie? Geneviève? Okay, we'll turn to the room.
Canadian Press. Thanks, Prime Minister. Have you asked Mark Carney to run as a Liberal in the next federal election, or are you trying to persuade him to?
As I said, Liberal conventions are always an opportunity to gather as Liberals and reflect on the ideas that can push Canada forward, that we will continue to discuss and debate between elections and building a platform. One of the things that we've always done is brought in strong voices who contribute to our reflections, sometimes partisan, sometimes independent, but always they feed the discussions that we have. And I'm very pleased someone with the expertise, particularly in the combination of economy and environment that work together, that is something that the Liberal Party has always stood for. And I look forward to seeing Mark's speech tonight.
Thank you. And I'm going to note you didn't answer the question, Prime Minister. On the universal basic income, you in the past have expressed that now is not the time to create or introduce a universal basic income. Members of your caucus obviously feel differently. Have you changed your mind, or is now still not the time to introduce a universal basic income, or do you feel differently?
I think one of the great things about Liberal conventions is people put forward strong and challenging ideas that get debated and discussed and looked at by people from right across the country. I think it's a wonderful opportunity. We know in the past that challenging proposals brought on the floor of the Liberal convention made it into policy and have shaped Canada over the past number of years. So I'm not going to comment on any specific resolutions, but I know that what Liberals are going to do this weekend is talk about a wide range of great ideas that will help move Canada forward. What they won't be doing this weekend is debating about whether climate change is real. That debate is settled for Canadians.
Prime Minister, Mike Lucatore with Global National. Dr. Tam just said, quote, "It's clear we need stronger controls in place." Your government can do more, and I just wanted to ask you, in the past, you have not hesitated from calling out premiers on climate change and their lack of action on it. So I just want to know why you're so hesitant to call them out for not getting shots into arms quicker.
I think one of the things that we've seen from the beginning of this pandemic, Mike, is the Canadians have been reassured by the fact that different orders of government are working together. And that has been something that is both reassuring, but also confidence building in a population that is rightly anxious about the path of COVID-19. Provinces and the federal government have worked together through this pandemic, whether it's been federal investments to support the provinces in healthcare, in rapid testing, in PPE, and now the federal government paying for vaccines that are being administered by the provinces. We are there to support them as they need to get vaccines in arms. And quite frankly, this has been something that we've worked on together over the past many, many months. We will continue to be there, and the provinces have just as much of a priority as everyone else to vaccinate as many people as possible, as quickly as possible, and that's what Canadians expect.
I just want to follow up on vaccines, and there's been criticism in the past for not getting more vaccines in the country sooner, and I know that you just mentioned that there will be 44 million by June, but do you think it was a mistake not to push the manufacturers to have more precise deadlines rather than just on specific, or I shouldn't say even on specific, just to have them delivered by a certain quarter? Would you not have preferred to have them A, earlier, and B, a more specific timeline for them to be in the country?
I think obviously we would have loved to have more vaccines much quicker, but let's remember, and I'll turn to Minister Anand for a follow-up on this, let's remember that there were no vaccines around against COVID-19 a year ago. These are brand new developments that the scientific community, the international community, experts have worked on incredibly hard over the past many months. And we are unbelievably lucky as humans that we have collectively been able to develop not just one effective vaccine against this virus, but many effective vaccines. But the challenge of developing a safe and effective vaccine is one. The second challenge is producing that vaccine at a scale that is going to make a difference around the world. And pharmaceutical companies and indeed countries around the world have stepped up to contribute to make sure that we are producing as many as possible and getting them out to people around the world. So we had commitments for 6 million vaccine doses arrived in Canada by the end of March. We blew through that target and got more. And over the coming weeks, we're going to be getting even more vaccines in. The end is definitely in sight, but we're not there yet. This third wave is more serious, and we need to hang in there for another few weeks to make sure that we can flatten that curve, drop those numbers down again, to give a chance for vaccines to take hold and to allow us to get to what will hopefully be a much more normal summer by the time the weather turns really nice. Anita.
Thank you so much, Prime Minister. At the time of contracting, we did not know whether a vaccine would be produced and when. We did not know the time of regulatory approval. And that goes for the vaccine suppliers themselves. As a result, the suppliers were reluctant, indeed refused to provide anything more than a quarterly delivery schedule. They would not provide weekly delivery schedules because of the fact that there was no vaccine in existence. As the Prime Minister mentioned, we began the quarter with 6 million vaccines targeted to come into the country. We ended March with 9.5 million vaccines in the country. We are accelerating rapidly in terms of our deliveries. We will see Q2 looking very different from Q1. For example, 6 million doses will be arriving in April. 7 million doses will be arriving in May, with 44 million overall prior to the end of June. Right now, 17% of Canadians have received at least one dose of vaccine. Canada stands 7th in the G20 in terms of doses administered per 100 people. As we have repeatedly said, our vaccine procurements and deliveries are rapidly accelerating. We have moved 22 million doses from later quarters to earlier quarters in the year, including, as I mentioned, 44 million doses expected prior to the end of June. We will keep working every single day with our suppliers to aggressively push them to deliver more doses earlier and earlier to Canadians. That's our government's priority, and that's what we'll keep working on. Thank you.
Tansei, Prime Minister, Theresa CTV National News. This question is for you, but also Minister Anand. Dr. Fauci has said that even if AstraZeneca gets approved, there is no plan to use the vaccine in the U.S. The Americans will soon have 90 million doses of AstraZeneca made and sitting unused in storage. But Canada has only received 1.5 million AstraZeneca doses from the U.S. Why haven't you been able to get more of those unused doses into Canada?
We continue our discussions with the American administration on getting more doses into Canada. We understand that they made the decision around vaccinating Americans first, particularly under the previous administration, but that continues under this one. We will keep working with them and ensure that we get more doses as soon as we can.
I might just add to the Prime Minister's comments that we, in our contracting, were deliberate in terms of ensuring that we could pull vaccine from many geographical locations in the world, the United States included. But at the current time, please note that we are pulling vaccine from Europe, from India, from South Korea, and from the United States. AstraZeneca in particular is one vaccine that we are ensuring we have a diversified source of supply from multiple locations. In terms of continuing to bring supply in from the United States, let's just remember that it's as a result of our contract for 20 million doses of AstraZeneca to be produced in the United States that we were able to do the exchange agreement with the United States so that when we have that 1.5 million doses in the country, which arrived last week, we will then return 1.5 million back to the United States. That's a very good model for additional deliveries into Canada. We are continuing to discuss this possibility with the U.S. administration, including through the excellent work of our ambassador, Kirsten Hillman. Thank you.
And thank you. And this next question is for Dr. Tam or Dr. Njoo. The European Medicines Agency has said they've started a probe into the Johnson & Johnson vaccine due to reports of the same blood clotting issues that have impacted AstraZeneca. What info does Health Canada have about this right now?
This is Theresa Tam. I can't speak directly to exactly what the regulator has. I'm not from that area, but I know that as per the clotting and low platelets issue related to the AstraZeneca vaccine, Health Canada is connected with all of its international counterparts, including the FDA. Of course, the EMA that has been investigating the AstraZeneca vaccine as well. It was always an area of increased vigilance and further inquiries because, as you may already have appreciated, the J&J vaccine or Janssen is the same type of vaccine, the viral vector vaccine, as the AstraZeneca vaccine. So with all due diligence, people have been actively looking for some of these similar cases with the J&J. So we're just beginning to see that coming through with the reporting. But I think as with the previous process, Health Canada will do their work. And then as needed, based on the information available, the National Advisory Committee on Immunizations and others will also be completed their work as they did with the AstraZeneca vaccine.
Thank you, Doctor. We'll now return to the phone for the one follow-up question. Operator.
Thank you. We have a question. Notre prochaine question est de Geneviève Normand de Radio-Canada.
Geneviève Normand, Radio-Canada, go ahead. Thank you for taking my follow-up question. It's about the convention that's coming up. Several resolutions are going to be debated at the convention, and they are quite a bit similar to those that are no longer the NDP. For example, guaranteed minimum income, guaranteed universal basic income. How can you be sure that you really have the best electoral process? Well, our priority now, as a government, as a Liberal Party, is to ensure that we are protecting Canadians from the coronavirus, and we are building back better. Obviously, Liberal activists will be discussing all kinds of different issues and so as to improve and contribute and help Canadians to build a better future. That's what we always do in parties' conventions. And I'm looking forward to hearing the deliberations and seeing how these will influence our vision for a better future for Canadians, for the middle class, for people who are working so hard to join it. But in all of our conversations this weekend on all kinds of subjects, I can assure you of one thing. There will be no debate about whether climate change is real or not, because for the Liberals, this issue is clear.
Thank you. That concludes the time the Prime Minister has for questions. The doctors and the ministers will be around for a little bit longer, and we'll start on the phone once the Prime Minister has left the room. Operator, back to you.